In other local news tonight, the COVID-19 vaccine has been widely available for about a year now. 41 NBC's Cameron Branscombe takes a look at our journey with the COVID-19 vaccine and where we go from here.
Around this time last year, the COVID-19 vaccine started its mass rollout. Since then, we've had 2 new variants along with booster shots. I talked to medical professionals about just how the COVID-19 vaccine has impacted communities. As speculation still swirls about the COVID-19 vaccine, more people have turned to getting the vaccine than when it first became available. Chief Clinical Officer from Atrium Health Navicent, Dr. Sandy Duke, says the proof is in the pudding. More people are seeing the effectiveness of the vaccine.
We see that it doesn't cause significant problems, and we've seen the protective effect. We've seen people be able to get an infection, recover quickly from that, and get back to work, and don't end up in the ICU, and it doesn't end up being a life-changing infection.
Public Information Officer for the North Central Health District, Michael Hawkinson, says the biggest difference between now and then is demand.
Health is very plentiful, and demand has not seen that spike that we experienced early on in the rollout of the vaccine.
Dr. Duke says the number of COVID cases are still high, but the new Omicron variant seems to be less severe. Dr. Duke says no one should be afraid of any of the vaccines.
We are protective against bad outcomes, admission to the ICU, and ultimately death. So whereas it might be attractive to say, go select which of them you get, if you can get a vaccine, it's going to protect you from being in the ICU and from dying ultimately.
Reporting in Macon, Cameron Branscombe, 41 NBC News.